that now with 20% of the orphans are under 2 years of age, and I hope that as we engage in this discussion and questions, we look at it from a broad perspective and figure out not only how do we address the immediate crisis, but also the future in terms of the impacts, but also in terms of the opportunities for the development of the infrastructure, and to make sure that food insecurity and all the other issues are addressed immediately also. So thank you again. Thank you, Karen, so much for this, and thank all of the members for being here.
Thank you, Congresswoman. I want to acknowledge two other people, Ambassador Molanda from Zambia, and also the First Secretary Lima of the Embassy of Angola. And if I've got other representatives whom I haven't acknowledged, can you please stand up so that we can? Okay, thank you. Sierra Leone, thank you. Thank you. Thank you. All right. Thank you. Thank you. Thank you.
President of Musulako Women's Organization.
Yes, thank you.
Koneko International, Senior Consultant for African Affairs.
I'm glad I asked that. So that we can see what a real engagement there is of the African representatives on this issue. Thank you. I am going to ask a question looking backward and then looking forward. Why West Africa? We know that the Ebola crisis was also earlier in Uganda, in Congo, in DRC, but it didn't reach this level. So one of the things I'd really like to hear someone talk about is why it had reached this level in West Africa. The second thing is on cultural brokering. What do we do to make sure that the initiatives for controlling Ebola are understood at a cultural level, both by people on the ground who live there and by workers, doctors, nurses, others who come in to work and contain the disease? How do we deal with those issues of cultural brokering so that everybody's speaking the same language? I'll just leave those there and now turn out and take some more questions and then ask you all to respond to some of them. Please come up to the microphone. Okay. We have 3 microphones. One is on the side here to my left, one in the center, and one to the right. So if you can line up at the microphones, I will literally move across like this. I'll start here in the center with Mel Foote.
Thank you, Mel Foote, Constituency for Africa. I first want to thank Karen Bass for her leadership. What a way to start the new year. Congratulations.
Yes.
Makes it sound like we're going to have a great year this year. I want to also thank the panel. I think the United States deserve a great deal of credit for what our response for Ebola. I think we stepped up to the plate, and we really did lead the world in terms of the response. You all deserve a great deal of credit for what you've done. Constituency for Africa is focused on the long term. You know, we already, the crisis in Liberia, Sierra Leone, and Guinea really laid bare the prospects of health care in Africa, really in those countries. And it was absolutely shocking to see people who could not even go to the hospital for having a baby or a broken leg or anything else, malaria, because of the threat of Ebola. So we got to think long term. And I would like to know if there's any discussion going on now, say with the White House and with USAID and others, about the prognosis for long-term infrastructure development. We're going to have a launching initiative on February 6th at the Africa Union Mission around infrastructure in Africa. And we want to tie in what we've done with Ebola. We thought after the HIV/AIDS crisis that we would focus on long-term health in Africa, and we didn't. We went to sleep. And I'm afraid we're going to go to sleep again after Ebola subsides. So I just want to know, are we thinking forward in terms of the long-term prognosis for healthcare in Africa? Thank you.
Thank you. I'm going to take about 4 or 5 questions. Can I ask you to make sure you only take a minute? Thank you. Oh, sorry. Let me go to the side first. There was somebody at, yes.
Thank you. Excuse me. Thank you very much. My name is Nia Quilty. My question, and before that, I just want to express the gratitude of the diaspora and people in Africa for the help of all manner of Americans, particularly the politicians who did not scare people during the midterms using Ebola. We are very glad that you didn't. We think that there is more work to be done, and so please don't get tired, especially rebuilding the economy, the healthcare systems, and also the culture. And when you are looking at the healthcare systems, please take into consideration that policies, international policies, help weaken the economic systems. Austerity measures that prevented investment into education and healthcare. So those mistakes, policy mistakes, we hope will not be repeated. Thank you.
Thank you. I'm going to take one more from that microphone, since you seem to have a lot right there.
Thank you, Madam Chairman.
And I'll come
I'm Ed Barber from Good Works International, a consultancy founded by Andy Young. I had understood that this current epidemic started in Guinea, and the USAID fact sheet we have states that there is still a lot of community resistance to some of these treatment units in Guinea, yet the number of cases reported in Guinea is less than 1/3 the number in Sierra Leone, a much smaller country. Why is that? Can anyone explain? And could I please just interject a personal appeal for all speakers to speak clearly and into the mics. It's sometimes hard for old guys like me to understand what's being said.
Thank you.
Thank you.
Thank you. Let's go to the mic over here on my right.
Okay, thank you very much. My name is Shari Paras, and I'm the president and CEO of the U.S. African Development Foundation. And I have a couple of questions. First, I just would love to get a sense from those on the panel what the end game looks like. Because as we talk about it in-house, people have expressed that the notion of a zero Ebola West Africa is probably not where we're going to end up, but some kind of sustained level of engagement. And so just your sense of where it's all going, number one. And then secondly, just to I don't know if any of the panelists have some information, statistics about the economic impacts of this situation, and particularly the cutting off of trade and engagement with these countries and what it might take to turn that around. Thank you.
Thank you. And then one final one here before we begin answering. We're going to come back to you, I promise. Yes.
Hi, Trisha Avasti from Anywhere Portable Sterilization. Could you please elaborate on lessons learned for supply chain in response to the current Ebola crisis?
Thank you. Thank you. Let's turn to our panel.
These are great questions. Thank you for your interest. I have to start with the end game question because I remain very confident that we can get to zero. We will not get to zero response. We will continue our efforts. We won't leave West Africa, but we will get to zero cases in this epidemic if we continue the way we're going and nothing unexpected happens. We can't be 100% sure of that. And in fact, the largest single risk facing us is that it might continue to fester, become what we call in public health endemic, meaning that it continue to spread at a low rate. That's not an acceptable outcome. Because if that were to occur, then it could flare up anywhere in these countries, anywhere in Africa again. So we have to get to zero, and we think that we can, and if things continue to go well, I think that we will, but it is going to be challenging. We'll need to leave behind staying at zero. First, get to zero, then stay at zero, and that's going to require monitoring, surveillance, and that gets to a second question that was asked, why did this happen in West Africa? Fundamentally, West Africa did not have the surveillance, response, and prevention systems in place that other places did. We've been working at CDC with Uganda, with DRC, with other places. In fact, I want to really thank the African Union. The African Union presence over the last couple of months has been a game changer in West Africa. They currently have more than 500 health professionals there, and many of them have gone through CDC-operated field epidemiology training programs. I traveled with one of them last month in rural Liberia, and he had done work on an Ebola outbreak in Uganda. Now he was in West Africa, but West Africa lacked the systems to find a health threat when it emerged, respond promptly, and that's why I think it spread more widely there. And just, I'll leave the other questions for others, but the question of why Guinea has had fewer cases, although it has more resistance, it has not, the explosive spread in both Sierra Leone and Liberia was in the urban area, and so far we haven't had that kind of explosive spread in Guinea, but they're not immune to it. And the problem of resistance or in the community is a major one, and it's not one type of resistance. It's many different types of resistance that have to be addressed differently, always to have services that are culturally sensitive, respectful, to address the perceptions of the community, and whenever possible to address the broader needs of the community as well. But this is something that other panelists can speak to, I think, very cogently.
Thank you for the questions. I just wanted to touch on the cultural brokering aspect of it. I think when we think about developing mechanisms for an effective response, like how can we develop an effective response that prevents one case from turning into an outbreak like it did in Liberia, for example. And as we talk about building the healthcare system, I think there's a lot of focus on infrastructure, but I just wanted to stress the importance of building local capacity as well. The international response in these 3 countries has been great, but I can't stress the importance and the critical role that the locals themselves have played. The local doctors, the nurses, the youth groups, the women's groups, the communities themselves. Even when we talk about orphans, extended families have stepped in. And this whole notion of it takes a village, you truly see that at play. So we need to also focus on building local capacity and really tapping into already existing structures and groups and systems when we talk about building up systems and mechanisms to prevent outbreaks like these. My organization, Face Africa, we are a local community development organization that has been working in rural Liberia. Our staff is 100% Liberian. When we were responding to Ebola, we had a much easier time dealing with communities, and we had a much easier sort of community entry level because we didn't look foreign. So when foreign companies and organizations and response teams come in, it's really important that they tap into these local groups and NGOs and organizations that already exist to facilitate that entry. I think that's really important.
I want to just emphasize the point that Saran just made. One of the huge takeaways from this response is that the soft interventions are just as important as the hard interventions. So the hardware interventions, building an Ebola treatment unit, shipping truckloads and truckloads of personal protective equipment, truckloads and truckloads of chlorine, those are critical, but they don't work if they're not wrapped around with a lot of good soft interventions, outreach, community engagement. If you don't have those, no one's going to come to the clinic in the first place, and it will continue to spread in the community. And that was the comment about resistance in Guinea. That's one of the biggest challenges, because if the community doesn't believe in Ebola, resists these people who show up in spacesuits in their community, and there's no groundwork laying before they arrive and so on, that doesn't work. So that local engagement and the local ownership of the response, and I'm sure Robbie can talk much more about what IMC's done in this vein, is absolutely critical to making the rest of the response work. Just and so your point on cultural brokering is absolutely critical. A couple of points on the long term. In terms of the prognosis for recovery and building out the health systems going forward, you can't separate the fact that this response is so much worse than all the other Ebola outbreaks from the fact that these health systems in these countries are so weak to begin with, and that they've never had to deal with Ebola before. So it's very pernicious in this environment because in the early stages it looks a lot like a lot of other diseases that are very common in that area, and that's one of the reasons it got so far along before it was recognized for what it was. There's no solution, and we will get to zero. I mean, to reinforce what Tom said, we will get to zero, and we have to get to zero. But in order to stay at zero and prevent future flare-ups from doing this again, there has to be the capacity in place, not just a generally stronger health system, but specific capacity in place to recognize and deal with this. And so that's one of the important things to build as we go forward. In terms of economic impact, I think what we'll see in the long run is probably not a huge macroeconomic impact out of this. You know, there hasn't been deep damage to the infrastructure of the countries or to the economic fundamentals of these countries. But what there will be is a lot of micro-level economic damage, and at community level, at household level, and particularly within the health system as well. You know, there are a lot of health staff who've been killed by this disease. Those people will need to be replaced. And then very quickly, sorry, there are a lot of questions to get through. The supply chain, the last question. In terms of lessons, I think what's been impressive is how capably the global commercial system has responded for this. We haven't faced ruptures in the PPE supply globally, but what we've also seen is it's a pretty complex process to get all this PPE ordered in this scale. You have to order different pieces from different suppliers and then package it and assemble it in a third place. There's not a good off-the-shelf PPE kit. So one of the things that the administration has done and that USAID is focused on very heavily is building a new PPE system. And so through a grand challenge that we launched with the White House, Johns Hopkins University designed a whole new PPE kit that is single piece. It's much easier to take off and put on. It's much safer. So we're working on getting that into production, and so for the next time this breaks out, we'll have better PPE to work with.
Thank you.
Most of the questions have been answered. I just want to talk a little bit about whether we're thinking about the future or not in terms of infrastructure. We are, and many agencies are already in discussion with USAID and other agencies about what comes next. You know, how can we rebuild a system that's much stronger than what we met even before the Ebola outbreak, because that's critical. And as Jeremy mentioned, we shouldn't only focus on the hard infrastructure. We need to focus on the soft infrastructure, on capacity building, on putting systems in place that actually could prevent such an outbreak in the future. I think it will be unforgivable if we do not take advantage of the world's attention now and build a much stronger system than the one we met when the outbreak happened. This is our chance actually to take advantage of all the investment that's taking place and making sure that whatever intervention we're having there is sustainable and it's not just a Band-Aid. I think we need to look at the end game. I agree. I think we will get to zero. I don't think there's any doubt that we will get to zero and we will stay at zero. I think we need to look at not just Ebola, we need to look at how we can prevent infectious diseases in the region, period. And that's very critical. Supply chain, it's been a struggle. As Jeremy mentioned, we've had to go to places in the US, to Russia, to New Zealand, to every supplier that we could get in order to get the types of PPEs that we need. But the commercial sector has provided what we need. And hopefully we will learn from this outbreak to be better prepared. In the region, there needs to be preparedness in the region, not just in the West where we can actually send staff and send supplies. All of that needs actually to reside in the region in West Africa.
Thank you. Just in response to one of the questions about economic impact, Jeremy, you talked about the secondary impacts. But IMF just said about a month or so ago that economic growth in West Africa slipped from 5.5% down to 5%. So it's clear that it has had an economic impact, and our challenge is going to be to make sure we begin to push that back up. Okay, I'm going to take 3 questions on this side, 3 here, and 3 here. Please start.
Thank you, Madam Chair. Thank you, panelists, and thank you very much, the audience. My name is Dr. Falal Amin. I'm a graduate from Howard University. I have recently written a dissertation on the topic on regional integration. I look at the analysis of the Mano River Union with particular reference to trade and economic development. So I have first-hand information about economic development we are talking about. And also, as I have alluded, in the research, I found out that economic development is key to Mano River Union. And Mano River Union consists of 4 countries, Sierra Leone, Liberia, Guinea, and Ivory Coast. Now, the only country that is not in this mix is Ivory Coast. Why? Because their border was closed. So now we have to look at if regional integration is to succeed, are we going to have open borders? So one of my recommendations are...
Let me ask you all to confine it to questions. Was that yours?
Yes, yes. Are we going to have health centers in this border post so that anybody who is coming in has to be checked that he or she is free from Ebola?
Thank you.
Thank you.
Thank you.
My name is Jibril Jallo. I'm a student of the Kennedy School of Government. My question is, there is passive resistance from communities. That is the narrative that we've been hearing. And it is not the other way, seeing the slow pace at which the international community themselves responded to this particular issue. I mean, if Sierra Leone has a budget of like 3 billion to run the country when we have problems worth of 15 billion, and we expect them to spread them right through, and the health sector is just one of them. And now I'm saying the focus again is like there's a mad rush of NGOs, international donors or whatever, going to the country focusing how do we prevent infectious diseases. We have other diseases that are not just like this infectious disease, like narrowing the gap. My question to you is how committed is like the USAID, the medical corps to really rebuild the health system in these countries?
Thank you very much for giving me the opportunity to ask these questions. Basically, actually, for me, it's more recommendation than questions. My name is Khadija Diallo. I'm in between Sierra Leone and Guinea, but I'm more so focused in Sierra Leone. I'm a registered nurse in this country. I've been a nurse for over 13 years. My focus is the healthcare professionals, the diaspora, ones that are seeking for help, especially in Sierra Leone. I know we are heading for the 0 cases in these countries. How can we achieve that? If you focus on one country, because that's what we are seeing, focus is in Liberia. That's what we are seeing mostly. The focus is more in Liberia than Sierra Leone. If you eradicate cases in Liberia, it's just a stone through to Sierra Leone, just a stone through to Guinea. Definitely, it's not going to end. If America is sending forces in Liberia and not Sierra Leone, and just hoping that United Kingdom will help, it's not going to happen. Their process is too slow. So we need help. We need the diasporans to be deployed, especially to Sierra Leone, to help our people. We know better.
1 minute, remember 1 minute.
I'm sorry. We know better than those over there. We can help them in terms of education and helping these NGOs. Please, we are pleading. Thank you.
Thank you. All right, let's take 3 here.
Good morning. I also want to thank Congresswoman Bass for this opportunity. I'm Barbara Simmons. I am Dean of International Education at the William V. S. Tubman University in Harper, Maryland County. We are happy that we've only had 4 confirmed cases, and we think it's because of the approach that Ms. Jones mentioned, that we involved the community immediately in terms of being proactive and preventive. My question would be, where's the sustainability piece? We're looking at, before Ebola, I never referred to our having health care in Harper. What we had, so that, as we know, is why the toll was so great with the Ebola. If there were a major hospital in each, in southeast Liberia, the middle, and the northern, for all of the billions that are going into the country, what are going to be the sustainable institutions or programs that can be pointed to? Our university, as our others, are about to open in March. What is the assistance or the plan in terms of addressing when all the students come back together?
Thank you.
So thank you for this.
Thank you. Yes, please.
Thank you very much. Thank you very much. I'm Gary Mabrouk. I'm with the Sierra Leone Health Task Force, Friends of Sierra Leone, and I was also Deputy Chief of Mission in Freetown of the U.S. Embassy back at the beginnings of the Civil War, where I directed U.S. relief efforts at that time. So I've got a friend over there asking one of the questions that I'm going to ask, so I'll go to the second one. Yesterday, a group of us were talking to many of the senior people in Freetown with UNMIR and the national health program there. And we heard, as we have heard, by the way, from one of our colleagues at the CDC, about, as we've heard many people say, there is as many people dying, there are many people dying of other diseases as there is from malaria in these countries because they can't get the treatment. So what is AID in particular doing and planning to do to address in the short term? I'm sure they're already planning for the long term, but in the short term to address these other diseases. And then put a little meat on my question, and then I'll quit. In particular, where are we in considerations for bringing over those Army engineers that are in Liberia over to Sierra Leone and going to the biggest source of doctors we keep ignoring, U.S. military doctors? Obama wrote out before, but elections are over.
Thank you.
Thank you very much. My name is Levi Sangha. I run a community college in Liberia, near Grand Bazaar Community College. And we have nursing school program, we have lab technician program, and health professional. My question has to do with two areas. Capacity building in the health sector, especially for the schools that run health institutions, medical school, as well as nursing school. The government had just announced that by February 2nd, we should open school. But one of my concerns is that we do not, when I say we, not just my college, the education sector does not have the capacity to sustain the preventive measures that have been put in place, especially for the thousands of schools and thousands of school children that are going to be coming back to school. My question is, one, is there any plan among the donors and NGOs to help the education sectors so that when school is open, it will not be a medium for spreading more of the Ebola virus? And two, those institutions that are providing or training nurses, medical workers, and so forth, do you have any plan to strengthen the capacity so that when this Ebola crisis is over, we'll be able to have local capacity, as Ms. Jones very eloquently pointed out? Thank you very much.
Thank you. Let's go here. We'll take 3 questions.
Yes, good morning, and thank you very much for the opportunity. My name is Alma Dumas Ali, and I am a Sierra Leonean. If there are any Sierra Leoneans in the house, can you please stand up and support me as I ask my question very quickly? Sierra Leoneans, all friends of Sierra Leone. So far, the international response to Ebola has been divided along old colonial or spheres of influence lines. That has been costly in Sierra Leone in terms of lives being lost, where even the British government has admitted its response has been slow and sometimes inappropriate. We just think sometimes inadequate. Now that Sierra Leone has become the epicenter of the disease, will the US adopt an epidemiological approach and become more involved in that country? and also Guinea, where the most recent WHO report indicates that progress has stalled. So in essence, we're looking at the $3.7 billion that has been appropriated or apportioned for the region, and we just want to have our own fair share as you try to eradicate Ebola in the region. Thank you.
Thank you. Thank you.
Good morning to the panel. My name is Millie Terry from Sierra Leone, West Africa. Congresswoman Bass, you said we should look at yesterday, for today, and for tomorrow. Yesterday, the continent needs to put the house in order. The continent needs to put the house in order. That's yesterday. Today, you're all here helping us to survive, to have these people. Tomorrow is what we have to look at. Sustainability. We've got to look at how we can educate our people. The doctors, the medical doctors, we've got 11 or 12 of them dying in Sierra Leone. There's no excuse for that. The panel, CDC, Congresswoman, let us look at what we have to do for tomorrow for the continent. And then we've got to ask the continent, take care of your people. Instead of buying cars, buy ambulances. Instead of building houses, build hospitals. They are accountable to us as Sierra Leoneans. Let us all not just stand and say, oh, the West has to help. We've got to help ourselves. We need to help ourselves. I thank you all for bringing us together to help our continent. Thank you very much.
Thank you.
Good morning. My name is Maurice Daniel. I'm with a company called IES Diagnostics. And this problem, this very large problem has brought a lot of resources to bear to address it. It seems that a lot of the resources are directed toward therapeutics and vaccines, which it should be. But I'd also like to call attention to the diagnostics sector of this issue. A lot of breakthroughs are happening, including early diagnostics. My company, IES Diagnostics, has developed an assay that can determine if someone has Ebola even before symptoms occur. What we believe is the earliest diagnostic test that exists today. And I just want to make sure that the focus for therapeutics and vaccines is not at the expense of early diagnostics. And just by the way, this diagnostic test not only applies to Ebola, but hemorrhagic fever, other Mabrouk-related diseases as well. So I just want to make that point. Thank you.
Thank you. All right.
There's a lot there to respond to, but let me start by saying that for the U.S. government, the priority is not Liberia. The priority is stopping Ebola. And from the CDC perspective, we have had for many months more staff in Sierra Leone than in either of the other countries. So our response as a U.S. government is to do what's needed where it's needed. We've had some challenges because of the speed of the epidemic, and the speed is, frankly, humbling. It changes so quickly, sometimes for the better, but all too often for the worse. One of our biggest challenges has actually been in Guinea, where we have a shortage of French-speaking public health experts, and so we've been working hard to identify additional people who can go to Guinea and have 32 prefectures. We want public health teams in each of those prefectures. We have at CDC now we're 30, 40 staff as we're scaling up, but not the 80 to 100 we have in Sierra Leone. So this has been a big challenge to us, but we definitely agree that it's a regional problem. I was in all three countries in August, September, and December. In all three countries in December, I saw tremendous progress, and there is a misconception I have to address. It is not that Sierra Leone has let the outbreak go on for longer. The outbreak, if you look at the data, the outbreak hit Sierra Leone about 8 weeks later. And we are hopeful that in the coming weeks we'll see the kind of rapid decrease in Sierra Leone that we saw in Liberia. But that doesn't mean we're out of the woods. We have a long way to go. And the more people we can get into the response, working effectively, will be critically important. Finding cases, finding contacts, tracing contacts. we're going from the phase of building ETUs and doing safe and dignified burials to the phase of identifying every case and tracing every contact and providing sensitive outreach services so that when people do develop Ebola, they're rapidly isolated, cared for, they can be more likely to survive and less likely to spread the disease. On the issue of diagnostics, we're very encouraged by several companies that have new diagnostic technologies. We at CDC have worked with them and provided technical support, and I hope that within maybe even a month we'll have a new point-of-care diagnostic test in trials in West Africa that would be able, instead of, just to be clear, the laboratory test that we do, and CDC has done more than 10,000 laboratory tests for Ebola in West Africa. The laboratory test we do only takes 2 or 3 hours. That's not the hard part. The hard part is getting the sample to the laboratory, because the disease is all over. When it broke out in Monrovia, it then spread to all over the country. When it broke out in Freetown, we're afraid we're seeing that same dynamic. But a rapid test that would allow you to diagnose it within a minute, within 20 minutes, and carry it in your pocket or backpack would really be very helpful. So it is important. On the schools, we're working very closely with UNICEF and with USAID and others. We think they should open. There's no negative epidemiologic aspect of opening, and there are many positives with learning, with education, with hygiene. There just have to be some simple things in place: hand washing, a way to take temperatures, and a protocol for what to do if someone gets sick. And finally, the issue of open borders. We've worked very hard with all of the countries that are affected to help them do screening of people who are leaving. Realistically, we're not going to close borders among the 3 countries. There are many places where people pass through that don't have official borders. So there's no alternative but to get to zero. But there are very important things that can be done to improve collaboration among the countries and in the region.
Thank
you. So a lot of questions on the regional scope and regional plans of the response. And as Tom said, the very clear mandate that we have from the President is not to defeat Ebola in Liberia, it is to defeat Ebola, period. And to that end, as the virus has moved, we have remained flexible and we have redeployed additional resources where we are seeing it pop up. So initially, we went in very big and very heavy in Liberia. As it got worse in Sierra Leone, we deployed, well, to take a step back, we actually had USAID emergency response personnel in all 3 countries from the beginning. The heaviest preponderance of those, of course, was in Liberia. As the virus got worse in Sierra Leone, we scaled up our team in Sierra Leone, and as the virus got worse or failed to get better sufficiently fast in Guinea, we scaled up our team in Guinea as well. So we now have responses in Guinea and in Sierra Leone, and amounts of money invested in Guinea and Sierra Leone in that response that would probably rival just about anything else my office is doing in the world outside of Syria and South Sudan. So very, very large major responses in both of those countries that, compared to what we normally do, are very large. So it is a significant investment in both of those countries. It doesn't look as big, and it's not quite as big as what we're doing in Liberia, because we're the lead donor in Liberia. We're not the lead donor in those other 2 countries, but we're playing a very substantial role and pursuing very vigorously the President's mandate to us to defeat this virus, because as one of the commenters said, it's a stone's throw. So if you defeat it in Liberia and you haven't defeated it in the other 2 countries, you haven't actually defeated it in Liberia either. It's just going to come back. So we know and we take very much to heart the need to defeat it in all 3 countries. On the question about DOD and DOD assets, we actually have deployed DOD assets to the other 2 countries where we see gaps, and so particularly around laboratories. A DOD lab was just sent to Sierra Leone, and it was, I think now has opened. We're also looking at sending one of those labs to Guinea, probably to work with the IMC, the new IMC clinic in Dubreka. So where we see gaps in the response that DOD can fill, we are tasking DOD to come in. But for the most part, we don't actually need a lot of DOD capabilities in those countries. The French military is deployed in Guinea. The UK military is deployed in Sierra Leone. And then there's a huge amount of civilian capacity that's come in through the NGOs and the United Nations to fill the logistics gaps and the construction gaps and the engineering gaps and so on and so forth. So we don't see huge gaps. that we would need the military to come in and fill. The military was really something to get, that they came in to give a very big surge to the operation initially, give us momentum, and they've done that very, very effectively.
Thank you.
I will try to answer a couple of the questions since many have already been answered. On the schools and universities and opening up the schools and universities, what we're doing, working with the USAID and the governments of, currently the government of Liberia, we're focusing on training the teachers on how to deal or how to identify and deal with a potential case. If they see somebody presenting, how to identify the symptoms, isolate, and make sure they refer to an Ebola treatment unit, because that's critical. But also working with the students on educating the students as well, as much as possible, to make sure there's proper hand washing, proper hygiene practices taking place. On reopening some of the healthcare centers, some of the hospitals, the question that the DCM asked, actually that started to happen. Yesterday was the first day that Lunsar Hospital actually opened up to treat patients, regular patients. And what we've done with funding from USAID is actually to create a triage right outside of the hospital where there are nurses and doctors that triage any patient coming in, anybody presenting with symptoms, isolated, then and checked further, and if they actually prove to be a potential case, they're referred to the Lunsar treatment unit. At the same time, we replenish some of the equipment and medicine and medical supplies and train all the doctors and nurses on protection, because that's one of the biggest things. And that's the way it needs to continue forward. This is one hospital. There are many hospitals and clinics. Primary health care is not working. We need to focus on primary health care and secondary health care in Sierra Leone, in Liberia, and Guinea. So this is just the first step, and USAID is actually taking the lead on discussing with partners in terms of how we can reopen a lot of the hospitals and clinics as soon as possible, because as you mentioned, people are dying from malaria. One thing that I didn't mention, which is critical, it's the community engagement. We work in an Ebola treatment units, but without the community, we would not have patients coming to the Ebola treatment units. This virus started at the community level, and this is where it should die. It will die at the community level. And we have to work hand in hand with the community, respecting the culture, which is critical, and making sure that actually the community understands the value of the referrals and the protection measures that we're putting in place, because one cannot function without the other.
We have Representative Jackson Lee, who's just come in, and we'd be pleased if she would have a word.
Good morning. Thank you so very much. Congresswoman Sheila Jackson Lee, good morning. I'm looking for my chairwoman and leader, Congresswoman Bass, but let me add my enormous appreciation to this very worthy event and this continuing event. To the panelists, to Dr. Michael, and if I may call to Jeremy and to Rabib and to Dr. Frieden and Sarah, thank you so very much. If I've called all your names for your presence here, this is a very vital discussion, and I know that I will capture all the essence of it as we leave to go to another meeting, but I know Dr. Frieden and I spoke during the Ebola issue. I'm from Texas, so we were sort of the center point, if you will, in the United States, and we're very engaged in as much of the issue of response as I know you have been discussing on the continent. For those of us who have considered our brothers and sisters in Africa, true brothers and sisters from our early days of being a student and traveling to Africa, we feel a kinship and a friendship. I would just offer to say that one of the things that I know that you'll be focusing on is the question of the medical infrastructure. Some decade ago, I began to try to talk to the Congress about collaborating on building hospitals in Africa, and the response was that that was not a, if you will, a foreign affairs appropriations priority. I think now is the time as we look to a legislative agenda, and of course, legislative agendas are not only here, but in our respective countries on the continent, but this would be an appropriate legislative agenda, that we look at the medical infrastructure, because as we look at the World Health Organization, we look at the Centers for Disease Control, they were looking for a network that they could plug into. As we sent plane loads of doctors, Doctors Without Borders, I don't know if any representatives are here from there. I want to give them, let's give them a large applause. They are an enormous asset.